Welcome to the Depth Dive. We jump into complex topics, pull out the key stuff, and hopefully give you something interesting to think about. Today we're tackling MRI safety. I mean, these machines are amazing, right? Seeing inside us like that. Incredible detail. But here's the thing, that power comes from some serious invisible forces. It's this weird paradox. Amazing diagnostics in an environment that needs really careful management to avoid being dangerous. So, our mission today, peel back the layers on the safety measures, maybe find some surprises, and see what makes MRI work safely.
Exactly. And we're grounding this in a key document, Safety Guidelines for Magnetic Resonance Imaging Equipment in Clinical Use. It's from the UK's MHRA. That's the Medicines and Healthcare Products Regulatory Agency. Think of it as the official playbook. It covers how to keep everyone safe, patients, the staff operating the machines, even just people nearby. So yeah, we'll pull out the most crucial bits, maybe some surprising details to give you a clearer picture of MRI safety without having to read the whole dense thing yourself.
Okay, let's start right there. What is it about an MRI suite that makes it so unique, hazard-wise? It's clearly more than just a giant magnet sitting there. Feels like there are layers to it.
Oh, absolutely. You're dealing with basically three types of magnetic fields, and each one has its own safety angles. First up is the main one, the static magnetic field. We call it B0. This is the big, powerful field that's always on, constant, doesn't switch off when the scan finishes.
Always on.
Okay.
This invisible presence.
Precisely. And your body notices it. If you move, especially quickly, in fields over about 2 Tesla, and scanners are often 1.5 or 3 Tesla, some even higher, you might feel things like vertigo, maybe nausea. Sometimes people see flashing lights, phosphenes, or even get a metallic case, usually temporary, but it shows your body's interacting with the field.
Okay, so direct biological effects, but that's not the main event, is it?
No, the really big immediate danger from the static field is the projectile effect. Anything ferromagnetic, think iron, steel, some stainless steels, nickel gets pulled towards the magnet. Hard. And the guidelines mention this chilling incident. A patient fatality occurred where the patient was struck in the head with an oxygen cylinder.
Wow, an oxygen cylinder just pulled in like a missile.
Exactly like a missile. It just hammers home why managing what comes near the scanner is so incredibly critical. Extreme vigilance is baseline.
That visual is potent, really shows the raw force we're talking about.
And it's not just being pulled in, there's also attractive force and torque. Ferromagnetic things get twisted to line up with the magnetic field lines. For some medical implants, that twisting force can actually be the bigger danger, potentially dislodging them or causing damage.
Okay, so pulling and twisting.
And then there's the lens effect, a bit more subtle. If you move a conductor through the field, it induces an electrical potential. At really high field strengths, like 7 Tesla, this can actually affect things like heart valve opening times, maybe by 30%. Compare that to less than 1% at a standard 1.5 Tesla. It's a noticeable effect at those higher fields.
Right, so the static field has these layers of risk. What about the other fields?
Okay, next you have the time-varying magnetic field gradients, DBDT we call them. These are the fields that switch on and off really fast. That's how the scanner builds up the image slice by slice.
And the risk there.
The main thing is peripheral nerve stimulation, or PNS. Those rapid changes induce tiny electric currents in your body. You might feel it as tingling, twitching. Sometimes it can be uncomfortable, even painful. Scanners have limits to stop it getting serious, like causing heart issues. But yeah, PNS is a common sensation.
Okay, nerve stimulation. And the third type?
That's the radiofrequency magnetic field, or B1. This is the field used to actually get the signal back from your body to create the image. The main biological effect here is tissue heating. Your body absorbs some of that RF energy. Scanners monitor this constantly. It's called the specific absorption rate, SAR, to keep it within safe limits. But some people are more vulnerable. Infants, pregnant women, people whose bodies don't regulate temperature well, they need extra care.
Heating. Okay, that connects to something you hear about burns, right?
It does, and it's a really important point. The MHRA guidelines state pretty clearly, burns are the most often reported MRI adverse incident in England.
Most often reported. Wow. What causes them?
It can be contact with metal in clothes you didn't know was there, ECG leads, coils used for the scan, even oxygen monitor probes. And here's a really surprising detail from the guidelines. Invisible metallic microfiber in clothing can cause burns. You wouldn't even see it.
Invisible fibers.
Yeah.
Seriously.
Seriously. The heat can build up. And another key thing, electrical burns may not be painful immediately. They can start damaging tissue at temperatures as low as 43 degrees Celsius. That's barely hot bath temperature.
So you might not even feel it happening right away. That's scary.
It means prevention and screening are everything.
Yeah.
And one last thing, acoustic noise. MRI scanners are loud, really loud. The guidelines say noise levels can exceed 85 dBA in almost all commercial MRI scanners. That's like standing next to heavy traffic.
Right, I've heard they're noisy.
Which is why hearing protection earplugs, earmuffs, sometimes both, is mandatory for patients and volunteers. Always.
Okay.
Unless they can prove the noise at the eardrum is below 80 dBA, which is rare.
Okay, wow. So you've got this constant strong pull, pulsing fields causing tingles, RF energy causing heating and potential burns, plus this deafening noise. Managing all that safely. It's complex. It really makes you think about who goes in there and what they have with them. It's clearly not just about the patient on the table.
Absolutely. Access control is fundamental. The space is divided into zones. You've got the MR controlled access area, basically the outer boundary. Then inside that, the minter environment, where the magnetic fields start to become a potential issue, and then the critical zone, the Mr. projectile zone, right around the scanner where something ferromagnetic will become dangerous.
So like layers of increasing caution.
Exactly. Access is super strict. Even things like keys for doors in these areas have to be non-magnetic. And managing equipment is key too. There's a standard marking system, ASTM F2503. It's like traffic lights. MR safe means no known hazards, non-magnetic, non-conductive. MR conditional means it's safe only under specific conditions, which must be followed perfectly. And MRC safe means keep it out.
And what about things without labels?
Crucial point from the guidelines. Items which are not labeled, Mr. Unlabeled, should be considered to be MR safe until determined to be otherwise. Default is unsafe, assume nothing.
Makes sense. Better safe than sorry. And screening people.
It's multi-layered. You get asked questions when booking, again when you arrive, and a final check right before you go in. That's for patients, volunteers, staff, carers, everyone entering the controlled areas. It involves detailed questionnaires, verbal checks, looking for anything potentially risky.
Like what sort of things?
Oh, a huge range.
Well.
Mechanical watches, credit cards, loose change, hairpins, bobby pins, certain glasses. Even some makeup can contain metallic bits. Body piercings, tattoos, especially older ones with different inks, clothing with metallic threads or conductive fibers, all need checking or removing.
Makeup. Wow.
Yeah. And some surprising things too. The guidelines mention pillows may contain springs and sandbags may contain metal pellets. Things you'd never think twice about elsewhere could have come projectiles.
Springs in a pillow. That's wild. Okay, so that's stuff on or with people. But what about things inside people? Implants, devices? That seems like a whole other level.
It is a hugely complex area. And this is where patient history is just vital. Take active implants, pacemakers, neurostimulators, things like that. The risk is severe. The guidelines grimly note there have been a number of deaths following the scanning of patients with implanted pacemakers, but often, quote, in most cases, the presence of the pacemaker was undetected before scanning.
Undetected. So the system relies entirely on knowing it's there.
Absolutely. Communication and accurate history are paramount. The risks. The device could move, it could get reprogrammed by the field, stop working, or even trigger dangerous heart rhythms like ventricular fibrillation. So, unless a device is specifically labeled MR conditional and all the conditions for its safe use are met precisely, specific scanner settings, monitoring, etc., the patient cannot even enter the MR environment. Full stop.
Okay, that's a hard line. What else?
Programmable hydrocephalus shunts. These drain fluid from the brain. The magnet can change their pressure setting without anyone knowing. That could lead to over or under drainage, causing serious problems. So their settings must be checked and reset right after the scan.
Right. Critical check.
Aneurysm clips in the head. These are a particular danger. You absolutely cannot scan unless you have documented proof the clip is non-ferromagnetic. Usually titanium is okay, but older stainless steel clips are a major risk. Knowing the material is essential.
Documented proof. No guesswork.
None. Then, even things like transdermal patches, skin patches for medication. If they contain metal foil, they can heat up and cause burns. And critically, the guidelines warn, heating of patches containing fentanyl may result in a serious overdose. They have to come off before the scan.
An overdose from a patch heating up, that's unexpected.
It shows how RF heating can have knock-on effects. Other implants too, hip or knee replacements can heat up. Heart valves, surgical clips, stents, eye implants, all need careful consideration based on their type and how long they've been implanted.
It's an incredibly detailed checklist for every single person.
It has to be. Then there's pregnancy. The MHRA advice is to scan pregnant patients using normal mode settings if possible, which limits the RF energy and gradient switching. If higher power controlled mode is deemed necessary, it requires a serious risk-benefit discussion involving the doctor who referred them, the radiologist, and the patient, especially in the first trimester. Minimizing RF and noise is key.
Okay, caution with pregnancy. And contrast agents. You hear about gadolinium.
Yes, contrast media. Gadolinium-based agents are vital for some diagnoses, but they carry a small risk of a condition called nephrogenic systemic fibrosis, or NSF, mainly in people with severe kidney problems. So there are strict rules. Checking kidney function is crucial. There's specific advice on dosages for people with kidney issues, for newborns, infants, pregnant women, even people getting liver transplants. It's about using it only when necessary and managing the risk carefully.
It's just layer upon layer of checks and considerations, isn't it? Both outside and inside the body. It's not just physics, it's deep into medical history and vigilance. So connecting this all up, it's not just the scanner and the patient, it's the whole room, the whole setup, the procedures.
Exactly. It's the entire ecosystem. The MR suite design itself is part of the safety system. Often uses that four-zone model we mentioned, physically controlling access. Shielding is also vital. Metal shielding in the walls contains the static magnetic field, stops it interfering with sensitive equipment elsewhere in the hospital. RF shielding, like a copper cage around the room, stops outside radio waves messing up the images.
Protecting inside and out, makes sense. You mentioned cryogens earlier, helium.
Right. Superconducting magnets need to be kept incredibly cold using liquid helium, sometimes nitrogen, cryogens, and quenching. The main hazard is asphyxiation if they leak. Helium gas is invisible, odorless, and displaces oxygen. The guidelines state, death by asphyxiation has occurred from the leaking of helium.
That's terrifying. A silent risk.
Yes. There are also risks of cold burns from the liquids, and even explosion if pressure builds up wrongly. That's why there are mandatory oxygen monitors in the scan room and carefully designed quench pipes to vent the gas safely outside if the magnet needs an emergency shutdown that's a quench. And a quirky detail showing the engineering. During a quench, it will be very difficult to break the control room window, as it may consist of 4 layers of glass, with mesh bonded between each of 2 layers. Built tough for a reason.
Built like a bank vault, almost. Okay, so the room is engineered. What about all the other gear used in there?
Equipment control and testing. Everything. Absolutely everything brought into the controlled zones, wheelchairs, monitoring equipment, infusion pumps, even cleaning supplies must be labeled MR Safety or MR Conditional. And remember, unlabeled means unsafe. You can't assume. Some sites use ferromagnetic detection systems, like metal detector gates, which the guidelines say are recommended as an adjunct to thorough and conscientious screening.
An adjunct. So they help, but don't replace the human checks.
Exactly. They're a tool, not a substitute for vigilance. Regular quality assurance testing of the scanner and safety checks on things like door seals and interlocks are also vital. Catching problems early.
And if the worst happens? Emergencies.
Emergency procedures are drilled. For a cardiac arrest, the absolute priority is to get the patient out of the MR projectile zone immediately. Resuscitation has to happen outside because standard crash carts and defibrillators are dangerously ferromagnetic. Any resuscitation gear used inside the MR environment must be specifically MR safe or MR conditional. For fire, they strongly recommend local fire crews visit the unit to understand the unique hazards, like not bringing standard axes or air tanks near the magnet. Only special MR conditional fire extinguishers can be in the controlled areas.
Right. Firefighters need special awareness.
Definitely. And during a quench, whether accidental or deliberate, evacuation is immediate. If it's a planned quench, the scan room door has to be propped open to prevent pressure buildup, making it impossible to open.
So it's physical design, tech safeguards, and rigorous procedures and training.
Absolutely. And overseeing it all are key people. Admissus is a responsible person with overall safety accountability, and an admissus safety expert, often a medical physicist, providing specialist advice. But safety relies on everyone. Operators, nurses, anesthetists, cleaners, engineers, managers having specific up-to-date training. It's a constant collective effort, not just a checklist.
What a deep dive that was. From the fundamental physics and invisible forces through all the meticulous checks on people and gear, right up to the engineered environment and emergency plans. It's a huge coordinated effort.
It really is. And these guidelines exist precisely because MRI is so powerful and it keeps evolving. It demands that constant vigilance, that team approach, to make sure the incredible benefits always outweigh the inherent risks.
So what's the takeaway for you listening? Maybe next time you or someone you know goes for an MRI, you'll have a bit more appreciation for all those unseen layers of safety, the intense screening, the specialized equipment, and the highly trained people making it all work. And here's something to chew on. The guidelines hammer home, do not become complacent. A simple incident can easily be escalated by thoughtless action. In our world of ever smarter tech, does safety ultimately always circle back to us, to human awareness and diligence? How do we make sure that vigilance keeps up, especially when the biggest dangers are the ones you can't see?